So when is government securing a COVID-19 vaccine? It's a question we're all asking, especially since other countries are already rolling it out. Now, South Africa missed the deadline to pay the deposit to secure COVAX vaccine supplies. The Deputy DG agreed to speak to us on the lead about this, but pulled out at the 11th hour, saying the health minister will issue a statement on this later today. So when does the vaccine become available in South Africa, and what's the approval process? Several coronavirus vaccine candidates are being evaluated by the South African Health Products Regulatory Authority. Let's speak to the chair, Helen Rees. She joins us live. Thanks for your time. Appreciate it. So let's talk about how many vaccine candidates are actually being evaluated now.
Well, so far, only one has been submitted, but several other companies have had preliminary discussions with SAHPRA, which is the regulatory authority. So what we've arranged through SAHPRA is what we call a rolling submission. This means that as data becomes available, as clinical data becomes available, companies can submit that data for review, and obviously as the big trials, the efficacy studies become available, that would then also be submitted. But this is in an attempt to really speed up the regulatory approval process.
Yeah, and this approval process, what does it entail for the benefit of those who are not too enthralled about the vaccines that we're seeing out there right now? Many people are still afraid about it.
Well, the first thing I should say to everybody is that, we're all familiar with vaccines. We're very happy, nearly all of us, to allow our children to have vaccines when they're very small, because we really recognize that they protect children against deadly illnesses. And we've done that for many years. So people shouldn't be afraid of vaccines. This has been part of the public health intervention for many years. But in terms of what we look for as a regulator, it's really what we call safety, quality, and efficacy. Those are the three pillars. All of the clinical data and the preclinical data, including animal data, we look at for safety. And that's a very, very big first question. Then we look at the efficacy data. Does the vaccine work? And this is where the big clinical trials of tens of thousands of people come into it. But then we also look at quality. How is it manufactured? How is it stored? Is it consistently manufactured? And so can we be satisfied that each lot of vaccines that gets delivered is going to have the same high quality as the one before? So quality is also very carefully scrutinized. Those are the three pillars. If a vaccine satisfies that, then it will get licensed. And we can either license it in an emergency under an emergency provision, or if there's sufficient data and we're satisfied, we can give a full registration.
So just in terms of getting it out there, how soon before we actually see vaccines in South Africa? You say one has been submitted. I think it's Johnson & Johnson from what I've read. When do we see that vaccine out in the country?
Well, I think that is the Department of Health is in negotiation. And we're also in negotiation with the COVAX facility. This is the big global facility that's negotiating on behalf of 190 countries now with all of the manufacturers of vaccines. So we might get other vaccines through the COVAX facility, but there would have to be a negotiation between the Department of Health and J&J on that specific vaccine. And first, we would have to be satisfied that there was good efficacy and safety data for us to allow that to happen. Yeah. But your question, when do we think? I think most of us are hopeful that we'll get some initial small quantities of vaccine in the second quarter of next year. Which vaccine it will be, we're not sure yet. But that would be the ambition, would be to have the first smaller quantities of vaccines the second quarter of next year, and obviously increasing the amounts of vaccines we get as quickly as we possibly can.
It seems like a long time away, Helen, especially since people are dying daily with the coronavirus.
Totally agree. And I mean, if we could do it more quickly, we would. But I think people must understand that the first vaccine that's got international registration is the Pfizer vaccine, which was about 10 months in the making. Now, prior to this, the quickest vaccine we've ever developed in the world was 4 years. So this has been an unprecedented speed up of vaccine development by many of the vaccine manufacturers. So although it does seem a long time away, from the time we started and the time we identified this virus and we got access to the genome, that was at the beginning of this year. This is actually really, really fast to generate all the data that's required for us to allow it to be distributed.
Yeah, I totally get that, but what I'm talking about is that the ordinary citizen is seeing people in the US and UK being vaccinated, and because we're not one of the richer countries, there's a delay in getting the vaccine to people here, which is why we are losing more and more lives.
Well, you're quite right. And when this all started, I'm involved with the World Health Organization and with Gavi, which is looking at this COVAX facility. I've been working with them since the beginning of this year. One of the things that we prioritized was precisely what you said. We recognized that if you look back at the pandemic flu of 2009, that the vaccines that were available were very quickly all purchased by rich countries. By the time we got them into the African region, the pandemic had come and gone. So we said that cannot happen again, and that's what the COVAX facility is intended to do. Because, as you say, rich countries have indeed pre-purchased lots of vaccines. They have deep pockets. They were able to purchase for their own citizens at risk because we didn't know which vaccines would work. But the COVAX facility, the aim of that facility is to try and level the playing field, to ensure that all countries in the first instance, through the COVAX facilities, get enough vaccines for 20% of their population, and that we don't see that all the rich countries will be fully immunized, all populations, and that months and months and months later, countries like South Africa and the African region will then get vaccines, but, as you say, with many more lives being lost.
Yeah. All right, thank you so much for your time and the insight. Appreciate it. South African Health Products Regulatory Authority Chair, Helen Rees.